right, so this week's video is about Swedish massage, cross-fiber massage, and myofascial release. So we'll start with Swedish massage. So indications, contraindications, and precautions. Swedish massage is indicated for relief of muscular pain, muscle spasms, encouraging collagen remodeling during healing, or forcing parasympathetic activity due to the area of the mid-back that is all tightened up because of over-sympathetic activation. We should be avoiding this for people that have bleeding disorders, or are on blood thinners, or have a low platelet count, suspected DVT in the area, over weakened bones, fractures or breaks in the area, or open wounds, skin infections, things of that nature. We also should be avoiding this for pain of otherwise unknown origin or suspicion of arteriosclerosis. So there are not many contraindications other than if you have pre-existing conditions. So if the patient knows the etiology of the pain, does not have any other pre-existing conditions, the contraindications are very minimal and the effects are very minimal on the negative end. For the preparation of the patient, we tell the patient the precautions, including the fact that this probably will hurt and it might cause a little bit of bruising. There's potential skin irritation from oils that are used. We don't have any oils here today to use. But if we did, there could potentially be some hypersensitivities to the oils the patient may not be aware of, so you have to let them know about that beforehand. Let the patient know that it is painful, but the pain's temporary and they should feel markedly better afterwards, and to not expect a pain greater than 8 out of 10. If they reach a pain greater than 8 out of 10, it's important to let the patient know that they need to let the doctor know, they need to let the therapist know to scale back the treatment a little bit, or they can tell the doctor to scale back or stop the treatment entirely if the pain is too great. So if you're otherwise uncomfortable at any time or in too much pain, please let me know. Okay? So the treatment is going to help increase blood flow, lymphatic circulation, relax tight muscles, increase mobility, and decrease stress in those muscles, which will help you feel better as well. So during this, I want you to just try to be still, try to be as relaxed as you can. Again, it could potentially cause pain and probably will cause pain, but just try not to fight me as much as you can. I know if it causes you pain, it's probably going to be a little bit difficult to do, but if it causes you, too much pain, of course, let me know. Okay. All right. So we will start with the first branch of Swedish massage. We will start with effleurage. So you can go ahead and go face down for me. So effleurage is a branch of Swedish massage that both begins and ends a Swedish massage session, using the palms of your hands, taking long strokes, both superficial and deep in the treatment area, in the direction of the heart. So we're always contacting the patient with one of our hands at all times. And in this example, I'm going to be using the paraspinal muscles of the low back. So I'll stand on this side of the table. Do you mind if I contact your low back? Okay. Sorry if my hands are a little cold. It's a little cold down here. Okay. So that looks something like this. Okay. You can come back up for me. Move on to the next one. All right, so next after effleurage, we have petrissage. Petrissage is a branch of Swedish massage that involves kneading the tissue. The tissue is sheared between the thumb and the pointer finger in a cross fiber pattern and kneaded between the fingers for the purpose of separating the muscle fibers and the fascia itself. Or if you're trying to remodel scar tissue, this is a good way to introduce healing in the right direction. Okay, so for this one, I'm going to be using the muscles of your forearm. So if you wouldn't mind rolling up your sleeve for me. All right, so again, this one entails taking the thumb and the forefinger of both hands and taking these wrist extensor muscles right here and getting underneath them and bringing them up like this. Separating that muscle from that fascia. Okay. All right. Next we have friction massage. Friction massage is a branch of Swedish massage that uses the fingertips, knuckles, and other relatively hard portions of the hand to go parallel in the direction of the muscle fibers for the purpose of increasing healing and heat and circulation between the skin and the muscle fibers. And again, in the case of scar tissue remodeling, to help remodel the collagen fibers and the muscle fibers and the scar tissue in the right direction. Okay, so for friction massage, I'm going to use your upper arm again here. And we're going to use the wrist extensor muscles one more time. We want to go with the direction of the muscle fibers. We know that the wrist extensor muscle fibers go this way, so we will use a thumb, and usually you would have an oil here. Make the glide a little bit easier. We go along the muscle fibers. Okay. All right. Next, I'm going to have you go face down for the next one. So tappement is a repeated light rhythmical striking of the skin used for respiratory ailments and mobilizing phlegm buildup for different respiratory conditions, or for pre-competition preparation to get the lungs moving and blood flow more to the lungs in the area of the muscles that contract and expand the lungs. So tappement uses the ulnar surface of the hand, loosely holding the hand to chop down in a rhythmic motion and a percussive type motion. So again, I'm going to lift up the shirt here and decontacting some of the thorax here. Okay. And tappement uses the ulnar surface of the hand with a light rhythmic striking. Okay. All right, you can stay face down for this next one. Okay, so vibration is the last branch of Swedish massage. Vibration is a branch of Swedish massage that uses either the hands or an instrument to deliver moderate, rapid, shaking strokes to the skin and muscle with limited joint movement for the purpose of activating systemic arousal and enhanced awareness of those muscles in the treatment area. This can be done by means of shaking the muscle in a repetitive movement back and forth with your hands over an underlying bone, or utilizing a vibration massage machine to accomplish the same goal. So while we don't have a vibration massage machine here, what we will do is we will use the muscles of the calf. So I'm going to go ahead and pull up the leg of your pant here, up to the joint line. Stabilizing the joint line, all we're going to be doing is with one hand, coming underneath the muscle, much like we did with petrissage, and shaking the muscle while holding the joint stable. All right, you can come on up. All right, so before we get into cross fiber massage and myofascial release, we'll go over some post-treatment actions with Swedish massage and then homework associated with the for the patient with this massage. The post-treatment work is going to be, and the homework assignments are going to be very similar from Swedish massage to cross fiber massage to myofascial release. So I'll say them here. If there's overlap, feel free to reference this portion of the video later on. After ending the session with a light amount of effleurage, which was the first portion of the Swedish massage that we did, instruct the patient to relax, take their time coming up, instruct them to move around and see how you feel post-massage. So go ahead and move around a little bit, just kind of motion kind of like this with your shoulders and with your low back, and move the legs around a little bit and the arm because I did a little bit of work there. So that's what you usually have them do. Instruct them to drink plenty of water for the next 24 hours as the release of toxins that were built up in muscle are released during a massage and can get into the bloodstream and cause a little bit of nausea and some things like that. So we want to make sure that we are helping the kidneys out, filtering the blood by drinking a little bit extra water. Okay. Again, alert the patient to tell you to, if they have any questions for you or concerns, anything like that over the next period of time before the next treatment, feel free to give us a call, more or less. Okay, so moving on to cross fiber massage. It's similar to friction massage, but always goes perpendicular across the bands of the tight muscle instead of parallel to the muscle like regular friction massage. This is for the purpose of relaxing muscle, breaking adhesions, and less about heating the muscle temperature between skin and muscle like friction massage did. Okay, so again, I would tell you this is probably going to hurt, may potentially bruise. If the pain gets above a level of 8 out of 10, please let me know to back off, or if you feel uncomfortable, we can stop at any time. Okay? So, For cross fiber massage, I'm going to have you go ahead and raise up the sleeve like we did for friction massage. And again, like we did for friction massage, we were going this direction. We're going to go across the fibers in this particular massage action. So we have some tight musculature right here. I have 5 to 30 seconds in each area where I'm rolling over bands of tight muscle 2 to 5 times. You can come down here and work the entire length of the muscle. You can do this 1 time the entire way up, or you can do this 2 times the entire way up and down, depending on how tight the muscle is and what the patient needs. Okay? So as a post check, you go ahead and just have them move that wrist around, move the elbow around, making sure that the mobility that they have is very similar to or better than before. Again, instruct the patient to drink lots of water and to give you a call if you have any other additional concerns. Okay? Lastly, we have myofascial release. So I'm going to have you go ahead and lay face down for me one more time. For this one, the contraindications, indications are the same as the Swedish massage and the cross fiber massage with regard to no open wounds, no surgeries, no suspected DVT, anything like that we spoke of earlier. The patient preparation is the same amount of pain is to be expected, potential bruising, and everything mentioned before. Myofascial release is a combination of traction and stretch, utilizing a moderate sustained force to produce viscoelastic lengthening and plastic deformation of the fascia. It combines effleurage, petrissage, and friction massage with muscle stretching. So it's using a lot of elements of Swedish massage as well as stretch. In more simple terms, we're attempting to stretch and lengthen the muscle to release it from the surrounding fascia that we expect the muscle to be adhesed to. Our goal is to lengthen the layers of fascia around the muscle to restore mobility and decrease fascial adhesions. Okay. So for the treatment application for this one, we always want to be stabilizing on the proximal end, and we want to be stretching to the distal end. So again, I'm going to be using your low back, so I'm going to bring your shirt up here one more time. Again, sorry if my hands are cold. So we want to be stabilizing up this way, like this, on a muscle, and we want to be coming down in a rhythmic motion like this, with a little bit of a stretch and a little bit of that effleurage motion that we had before. You would repeat this bilaterally as needed. All right, you can come on up. Post-treatment actions are the same as the other types of massage. If there are any questions or pain or concerns, please let me know. You should be experiencing a little bit better mobility. And if you have anything that you are concerned about, of course, give me a call or shoot me a text. Let me know. Okay? This concludes our video of massage.